Hi, I'm Dr. Cedric Echols, Health Commissioner for the City of St. Louis. As COVID-19 cases continue to rise in the City of St. Louis and in other places throughout the world, the City of St. Louis Department of Health has been receiving questions about COVID-19 testing and treatment measures. I would like to take a moment of silence for those who have lost their lives to SARS-CoV-2 and systemic racism. Cedric from zip code 63107 asks, I'm having difficulty accessing COVID-19 testing. Is there a website I can use to get information on open testing sites and their hours of operation? Taking measures to prevent the spread of infection will be the most effective strategy for getting us safely back to work and school. Testing can help people determine if they are infected with SARS-CoV-2, regardless of whether they have symptoms and whether they are at risk of spreading the infection to others. To find locations for COVID-19 testing sites in the City of St. Louis and the St. Louis metropolitan area, please call the City of St. Louis Department of Health at 314-657-1499, Monday through Friday from 8:30 a.m. until 5 p.m. Or visit the City of St. Louis website at www.stlouis-mo.gov. When you go to the website, please click on the COVID-19 information banner. Afterwards, click on the testing information link. On this page, you will find the names, addresses, and operating hours for COVID-19 testing sites in the City of St. Louis. Any eligibility criteria will also be listed on this page. Yvonne from zip code 63147 asks, members of my immediate and extended family are symptomatic, but they are afraid of being diagnosed with COVID-19. What should we do? During the COVID-19 pandemic, individuals have faced psychological stress caused by fear and anxiety due to the high transmission and mortality rate of the disease, the social isolation, economic problems, and difficulties in reaching health services. Although knowing your status can be stressful, it is important to receive a timely diagnosis of COVID-19 to prevent developing severe complications from the virus and to begin measures to prevent spreading the virus to others. Some healthy ways to cope with stress include: take breaks from watching, reading, and listening to news stories, including those on social media. It is good to be informed, but hearing about the pandemic constantly can be upsetting. Consider limiting news to just a couple of times a day and disconnecting from phone, TV, and computer screens for a while. You can take care of your body by getting vaccinated with the COVID-19 vaccine, taking deep breaths or stretching, eating healthy, well-balanced meals, exercising regularly, getting plenty of sleep, avoiding excessive alcohol, tobacco, and substance use, continuing with routine preventive measures such as annual health screenings and dental screenings, vaccinations, cancer screenings, etc., as recommended by your healthcare provider. Make time to unwind. Try to do some other activities you enjoy. Connect with others. Talk with people you trust about your concerns and how you are feeling. Connect with your community or faith-based organizations. While we are experiencing this increase in COVID-19 cases, do your best to implement social distancing measures. Try connecting with family and friends online, through social media, by phone, or mail. Christine from zip code 63116 asks, I knew someone who tested positive for COVID-19. Initially, they were okay, but eventually they developed severe symptoms and died. I have heard that treatment is available for insured people through hospitals. Are there treatment services available for uninsured and underinsured individuals in the community? The City of St. Louis Department of Health has partnered with Affinia Healthcare to provide monoclonal antibody infusion treatment services for COVID-19 patients in the St. Louis region. The treatment is prescribed for patients who have mild to moderate COVID-19 symptoms and an elevated risk of complications, and their close contacts. Data from clinical trials showed that high-risk patients treated with monoclonal antibodies had a 70% reduction in relative risk of progression to severe disease or hospitalization compared to patients who did not receive monoclonal antibodies. The treatment is being provided at no cost to the patient thanks to Community Development Block Grant COVID-19 funding awarded to the City of St. Louis. Please call Affinia Healthcare at 314-449-3553 to speak with a treatment representative. Thank you for tuning in this week, and thank you to Cedric, Yvonne, and Christine for submitting questions. Be sure to tune in next week for more critical public health information. I want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well, St. Louis.